Hey, it's Dr. Anderson from Natural Health Solutions. You've probably seen the headlines about thyroid cancer on the rise, right? But here's the real deal. It's not a cancer crisis, it's a diagnosis craze. Thyroid cancer sounds scary, right? But here's the good news. It's actually one of the most treatable cancers out there. Today, we're diving into why the stats can be alarming, the different types of thyroid cancer, modern treatments, and what life is like after a diagnosis. It feels like everyone knows someone dealing with a thyroid nodule these days. But here's the truth that might surprise you. We're not facing a cancer epidemic. What we're actually experiencing is a diagnosis epidemic. And here's some reassuring news. For most people, thyroid cancer is one of the most treatable cancers known to medicine. Today, we're going to dive deep into this topic. We'll explore why the numbers look so alarming, break down the different types of thyroid cancer, discuss cutting-edge treatment options, and paint a picture of what life looks like after a diagnosis. Let's start by addressing those scary-looking numbers. Globally, thyroid cancer diagnoses have skyrocketed in recent decades, especially among women. But before you panic, listen to this. Experts are calling this an incidence illusion. What does that mean? Well, it's all about perspective. First, let's talk about technology. We now have ultrasound machines and imaging techniques that can detect thyroid nodules as small as a single millimeter. That's incredibly tiny. Most of these minuscule findings are what we call papillary thyroid microcarcinomas. Here's the kicker. The vast majority of these would never grow or cause any harm if left undetected. Then there's the silent nature of the thyroid itself. This butterfly-shaped gland in your neck usually does uncaused pain or noticeable symptoms until a tumor is quite large. So what's happening now? Many thyroid cancers are being discovered completely by accident during scans for totally unrelated reasons. So, when we say there's a rise in thyroid cancer cases, it doesn't necessarily mean more cancer is developing. It means we've gotten incredibly good at finding what was always there, hiding silently. Now, let's break down the four main types of thyroid cancer, because not all thyroid cancers are created equal, and your outcome depends almost entirely on which type you're dealing with. First up, we have papillary thyroid cancer. This is the heavyweight champion in terms of frequency, making up a whopping 80 to 90% of all cases. The good news, it's typically slow-growing and highly treatable. In fact, if it's caught while still localized to the thyroid, the 5-year survival rate is over 98%. Those are odds we like to see. Next, we have follicular thyroid cancer, accounting for about 5 to 10% of cases. This type is also highly treatable and is often grouped together with papillary under the umbrella term differentiated thyroid cancer. Third on our list is medullary thyroid cancer. This one's a bit more aggressive and only makes up about 1 to 2% of cases. An interesting fact about medullary thyroid cancer is that about 30% of cases are hereditary. If you're diagnosed with this type, it's crucial to get your family members genetically tested. Lastly, we have anaplastic thyroid cancer. This is the rarest form, accounting for less than 1% of all cases. It's also the most aggressive and challenging to treat. But remember, it's extremely uncommon. Now that we've covered the types, let's talk treatment. The landscape of thyroid cancer treatment has evolved dramatically in recent years. Gone are the days of one-size-fits-all approaches. Today, we have a range of options tailored to each patient's specific situation. For most cases of differentiated thyroid cancer, treatment typically starts with surgery. This usually involves removing part or all of the thyroid gland. It sounds drastic, but here's the silver lining. Your body can function perfectly well without a thyroid, thanks to hormone replacement therapy. After surgery, many patients undergo radioactive iodine treatment. This is a fascinating process where patients take a dose of radioactive iodine, which is absorbed by any remaining thyroid cells, including cancer cells, effectively destroying them. It's like a targeted missile strike on a cellular level. For more advanced cases, we now have targeted therapies and immunotherapies. These cutting-edge treatments are designed to attack cancer cells while sparing healthy tissue, often with fewer side effects than traditional chemotherapy. But what about those tiny papillary microcarcinomas we mentioned earlier? Well, in a growing trend, some doctors are advocating for active surveillance instead of immediate treatment. This means closely monitoring the nodule and only intervening if it shows signs of growth or spread. It's a less is more approach that's gaining traction in the medical community. Now, let us address a question that's probably on your mind. What does life look like after a thyroid cancer diagnosis? The answer, for most people, is surprisingly normal. Yes, you'll need to take thyroid hormone replacement medication daily, but once your dosage is dialed in, most people feel completely like themselves. You'll have regular checkups and blood tests to ensure your hormone levels stay balanced. But these become routine over time. Many thyroid cancer survivors report that the experience gives them a new appreciation for their health and well-being. Some even say it's a wake-up call that leads to positive lifestyle changes. Of course, there can be challenges. Some people struggle with fatigue or weight management as they adjust to life without a thyroid. But with proper medical care and support, these issues can usually be managed effectively. It's also worth noting that thyroid cancer has one of the highest survival rates of any cancer. For localized papillary and follicular thyroid cancer, the 5-year survival rate is near 100%. Even for more advanced stages, the outlook is often very positive. So, while a thyroid cancer diagnosis can certainly be scary, it's important to remember that for most people, it's a highly treatable condition. With modern medicine, skilled doctors, and a positive outlook, many thyroid cancer patients go on to live long, healthy, and fulfilling lives. As we wrap up, let's circle back to where we started. Yes, thyroid cancer diagnoses are on the rise, but now you understand that this isn't necessarily cause for panic. It's a reflection of our improved ability to detect even the tiniest abnormalities. The key takeaway here is that knowledge is power. Understanding the realities of thyroid cancer, its types, treatments, and prognosis can help dispel fears and empower patients to make informed decisions about their health. Remember, if you or someone you know is facing a thyroid cancer diagnosis, there's real hope. With each passing year, our understanding grows, treatments improve, and outcomes get better. So take a deep breath, arm yourself with information, and know that you're not alone on this journey. Thyroid cancer may be making headlines, but for most patients, it's a chapter in their life story, not the whole book. With proper care and a positive attitude, there's every reason to look forward to writing many more chapters ahead.